Hi, everyone. I'm Governor John Carney. Thank you for joining us for this COVID-19 update virtual town hall meeting. Normally, we have a press conference on a weekly basis. It's usually Tuesday, as this is a Tuesday night. We did not have our press conference last week because it was the day of my swearing in to this term as governor. And thank you to all of you for the opportunity to serve another term for every Delawarean. This week, today, we had the State of the State address, and so we were not able to have our normal press conference today as well. And so we're having another town hall meeting to give you an update on the COVID-19, its presence, the presence of the virus in our state with respect to the number of cases. We'll do a real quick rundown on the data as we do each week. Most of the focus and the questions tonight, and this was really more about your questions than anything else, we'll be focusing on our all hands on deck vaccination effort to make sure that we get as many people vaccinated in our state as possible with the supply that we're getting. Right here at the top, I'd like to again thank you as citizens of the state of Delaware. I want to thank all employees of the state of Delaware, and in particular, the employees at Del.gov and DMV for your help with traffic control, with some of the high throughput clinics that we've had over the last couple of weeks in what we've called the sprint. The last week to 10 days, we've been sprinting to get more vaccines out of refrigerators and off shelves into people's arms so that we can get as many Delawareans vaccinated as possible. We've moved we continue to do 1A population. Those are healthcare workers. Many of those workers, most of the initial vaccines that we received, 30,000 of the first 50,000 went to hospitals to vaccinate their frontline employees and workers that have been just doing an incredible job. We've also used them. They've also vaccinated their medical partners in the communities in which they're located. We've utilized some of those vaccines for our pods as well to do first responders, law enforcement, paramedics, and we've gotten a significant number. The vast majority of the vaccines that we've been delivered have been delivered to that 1A group. We started last week vaccinating seniors 65 and older, with a focus on the older people in that age group and that demographic, if you will. We've done some of that with large pods. I want to apologize right up front for those of you who were inconvenienced over the weekend in the pods that we had at the Georgetown DMV and the Delaware City DMV for a lot of different reasons. We had difficulty with and if we could get the chart up on the screen, you can see now these numbers are actually really good news. I'm sorry to say we're down to 7-day moving average of new cases at just over 600. You might remember, those of you who have been following the numbers throughout the last 9 or 10 months, that we were arguing with the state of New Jersey and other states in our region about being below 100 new cases a day on a 7-day moving average. But this number's been a couple hundred, over 800 new cases on a 7-day moving average after the holiday season, Thanksgiving and Christmas. Our percent positive now is going down as well. We were over 10% on the 7-day moving average. And really importantly, our hospitalization number is down under 400. We were up as high as 470, and now we're at 383. So all these numbers, all this data is moving in the right direction. We got our fingers crossed and praying that we keep headed with fewer cases each day, with lower percent positive in the testing that we're doing, and with fewer hospitalizations. Sadly, we're over 1,065 Delawareans have passed due to COVID-19, and they're all friends and neighbors of ours. The next screen, we talk a little bit about, I mentioned this early on, the sprint that we've been in to try to get vaccines out of freezers and into people's arms. Over the weekend, we had the pods at Delaware City and the Georgetown DMV. Saturday was not really that good. We got thousands of people vaccinated. We had logistical issues and traffic backups, and apologize to all those who were inconvenienced and had to wait way too long in line to get your vaccine. The good news is you received a vaccine. Hopefully those who had to quit the line, we're trying to make accommodations for you. 11,000 though vaccinations were done at the 2 clinics on each day, Saturday and Sunday, at Delaware City and Georgetown. Sunday was much better. We learned a lot from the challenges of Saturday, and Sunday went much better. And we again got thousands of Delawareans vaccinated. We also had a report on with our partners, our hospital partners. Christiana Care had events over the weekend, Friday, Saturday, and Sunday, and they vaccinated just short of 3,000 folks. We expect that they'll be a good and strong community partner as we move forward. These were mostly 65 and older patients in their primary care and network, and for those who were able to sign up. And we have 2,600 doses left in the warehouse by the end of the weekend, with significant resupply coming next week, this week and next week. So one of the really good news to report today, we did have our White House call, the first White House call with Jeff Zients, who's President Biden's COVID-19 coordinator. And the best news of the call was that each state will be receiving a 16% increase in their allotment over the next 3 weeks, with some certainty around that. That's a very positive development. For us, 16% increases anywhere from 2,500 to 3,000 or a little bit more, depending on the past performance and what they're basing that base allocation on. So that'll give us enough time to again do more vaccinations in our targeted populations to make sure that we get the spread, the demographic spread, and the diversity that we need in all communities in our state, to make reservations of some of those doses for those who've already received their first vaccine, particularly our frontline health workers, our paramedics, frontline law enforcement officers. Dr. Rattay, we have a number of questions around second doses and as well as where to get your first dose. So next slide tells you a little bit. We expect over the next weeks and in the weeks and months ahead to rely more on pharmacies and primary care. We will have a large vaccination events in Newcastle, Kent, and Sussex County. We have 2 partners that are coming on board. Curative, which has been doing a tremendous job with COVID-19 testing in sites across our state, and Vault, which has been doing considerable testing as well. We are trying out different approaches using them as a partner to get, again, vaccines in people's arms. But primary care, pharmacies, and a lot of targeted outreach. We really need to get communities, particularly communities of color across our state, that we have not been able to reach with some of these general DMV clinics and some of the other clinics we have. And so we'll have some targeted outreach there. We did have one today. We'll see what the results of that in the city of Wilmington at Del Tech, what the results of that gave us. So with that, I mentioned a little bit about Vault and Curative. Dr. Rattay, maybe you want to expand on those partnerships, which I think will be a big help for us. I was going to say shot in the arm, and I think maybe that's not a good, maybe it is an appropriate analogy.
Thank you so much, Governor. And so as you were just mentioning, we know that one approach or one type of event is not going to meet the needs of Delawareans. We are really excited to get to partner with Vault and Curative. They really have been great partners with us for testing. For Vault, we've had an event just today working with individuals in the Wilmington community to get 500 individuals vaccinated. With Vault, we're really going to work closely with them to try to reach some of our communities of colors and some of our lower income communities where it can be harder to reach people, harder to get people engaged for vaccination. And so we're really grateful to have kicked off this partnership with Vault today. We're also kicking off our partnership with Curative this week. So this wait list that many Delawareans now are on, which are individuals who are 65 and older. We used folks who we invited folks who are on that wait list to these two curative events, both in Dover, Wednesday and Friday. And within a short amount of time, the 750 slots did fill up, which is great. Clearly, there's a lot of interest, but we're excited about this first events with both Vault and Curative this week. And again, we're sure that there will be lessons learned from these events as well. We at DPH, as the governor said, we had a lot of lessons learned this past weekend. The weather really had a big impact on us. The two locations we went to were different than the Dover DMV, so there was less space. We had some technology issues and a number of other barriers that we were able to break through. But one of the things that really was concerning to us was the weather and the impact of the weather on both our technology as well as staff. And so we're looking forward to trying another event this weekend that's going to be an indoor event. Again, we'll be sending invitations to people who are on the waiting list to this event. So for those who are on the waiting list, just stay tuned. It's a large list, but invitations are forthcoming for this event soon. For those who want to join the waiting list and are not yet on, again, this is only for folks who are 65 and up at this point in time, but go to vaccinerequest.delaware.gov to get your name on the waiting list. So let's go to the next slide. I want to talk about a topic that is really top of mind for many folks who are in the 1A category who haven't received their second dose. Now, there are many folks in the 1A category who have received their second dose. Some have not. Additionally, we've been able to reach out to and vaccinate a number of folks who are 65 and up in the last few weekends, and we're getting a lot of questions now. What about the second dose? We first wanted to just talk a little bit about the numbers. We are in a really challenging situation right now where the supply of this vaccine is so extremely limited. For example, this week we're expected to receive 18,000 doses, but if you look at the 1A category, it's 70,000 people, which all need 1 and 2 doses, right? So that's 140,000 doses. And in the 1B category, it's 200,000. So that's 400,000 doses. So the amount of doses that we're receiving right now are just so limited in comparison to the numbers of individuals that that we want to get vaccinated. And so, as the governor said, we received some good news from the White House today. Our doses hopefully will start increasing. Additionally, it looks like on the horizon there may be some additional vaccines available to us. The Johnson & Johnson vaccine is one that may be next on the horizon. But right now, in this period of time, which hopefully is just a few weeks, we are really, really, really limited in the amount of vaccine that we have. And so what we're trying to do is make the most of this vaccine to offer the most protection that we can for Delawareans. The first dose provides, from the science tells us that the first dose provides about 52 to 80% protection. Now, all that was studied from this dose, from these two vaccines so far, suggests that you do want to do a second dose. So the science is supporting a second dose, and we want to make sure that everybody who gets a first dose of the Pfizer or the Moderna vaccine gets a second dose. But the time period is in question. Does it really need to be 28 days? The science is suggesting that it doesn't necessarily have to be at 28 days. So we want to make it available as shortly after 28 days as we can. But we also want to use this time when we have such a limited amount of vaccine to make sure that we're offering the most protection to the most Delawareans. We know from the science that these vaccines are 50 to 80% protective against getting infected, but they're even more protective against death and hospitalizations. And so our goal is to do everything we can to prevent any additional deaths and hospitalizations in our state. So we do have a focus right now on getting first doses into as many people as possible, but also making sure everybody gets a second dose in a timely period. And when we are offering those second doses, we're phasing them in based on risk. So those who are at the highest risk are in 1A, are those who are providing care for COVID patients. And so that's how you'll see this roll out. But we want to assure everyone second doses will be offered to everyone.
It's also important to point out, and this came on our hospital call this week, is that, as I mentioned at the top, hospitals received about 30,000 of the first 50,000 doses that we received in the state. Some of those were second doses, and they have been delivering those second doses to some of their frontline healthcare workers, and so that is happening. Thousands of those have been distributed there in the hospitals. So we've got a lot of questions, and why don't we go? We have John Starkey here. You'll hear his voice. You won't see his face, but he's out there and he's got questions for us. John?
Thank you, Governor. I do have a bunch of questions, and we have a lot of questions, as you might expect, Dr. Rattay, on the second dose. I know you just went through the process on the second dose, but we have a question in the pre-submitted comments here, and I am just getting to it. It's just, can you go over the process, particularly for 1A vaccinated individuals, so 1A eligible Delawareans? What is the process currently for getting them the second dose of the vaccine?
Yeah, so for some folks who received their first dose, they have received their second dose already, and many of those are individuals who received their vaccinations and work in our health systems. We do have other individuals, though, for example, those who went to our vaccination events, some of our first responders, school nurses, and some others. And we are working on a plan to get started. We did not cancel those events, but we put them on pause while we were really trying to figure out strategically, how do we maximize this scarce resource that we have? But we are going to get restarted. But again, you'll see us phasing this in based on risk. So we want, whether you're an EMS provider who provides direct medical care and you already got your first dose, or school nurses and others, stay tuned. You will be receiving outreach as far as when and where the second dose will be available to you, and it will be over the coming weeks.
Thank you, Dr. Rattay. And a follow-up on that question from Catherine Maple in the comments. She says, I know it takes both shots to be protected, but does the first shot afford any protection at all?
Yeah, so, obviously there's a lot we don't know about these vaccines yet because they haven't been around that long, but the first dose provides pretty good protection, 50 to 80% protection, meaning preventing infection for those who received the vaccine. And again, the results of that also demonstrate, even higher protection against death and more severe consequences. So there's definitely protection from the first dose. And again, we want everyone to be able to get the second dose, but please be assured if you have received the first dose that, it usually takes a good 12 to 14 days before you have some immune protection, but we're seeing good results just from one dose with these vaccines.
Thank you again, Dr. Rattay. And here's one for you, Governor, from Chris Oratorio in the pre-submitted questions. Chris asks, Governor Carney, have you received the COVID-19 vaccine? Is his first question. And the second is, will you receive it before seniors in Delaware have access?
Yeah, no, I have not been vaccinated as yet. My number hasn't come up, and my number won't come up prior to the seniors 65 and older, which is the 1B group that we're moving into. We have a system. It's on our website. It's very transparent where the priorities were set for the distribution of this limited public good. And that's what really the way we're looking at it. We're looking and following the advice that came from the national panel that recommended priorities for the distribution of this scarce resource, life-saving vaccine. And we had a local panel that made similar recommendations, some adjustments. Right now, we're struggling with the advice coming out of CDC about second doses. We're hoping to see more vaccines, but in doing so, you saw the chart, if we could put the chart back up that showed the limited supply. We're getting, and it's on our tracker. All this is transparent on our tracker. If you go vaccine tracker at de.gov/coronavirus, you can see the flow of the number of doses that we get each week, the number that are administered, and you can keep track. We get about 18,000, 15 to 20,000 thereabouts. We don't know until the end of the week before, the middle of the week before, so it's very hard to plan and to get a network ready to deliver. Compared to, so 18,000 a month or a week compared to 70,000 1As that we have to vaccinate times two vaccines, 200,000 or so 1Bs times two. Just do the math, it's over 500,000 vaccine doses that have to be delivered. We're getting 18,000 a week. So that's the math. You have to prioritize. We're following the science. It's come from expert public health panels, completely transparent. The delivery is transparent on our website. No, I have not been vaccinated yet. My number hasn't come up.
Thank you, Governor. And I think this is another one for you as well. You talked a little bit about this during the presentation, but Andy Vincent in the comments asks, what are you hearing from the federal government and or the vaccination manufacturers concerning production of the vaccine and distribution?
Yeah, I thought some good news. Dr. Rattay was with me on the White House call just this afternoon after the State address. Jeff Zients, who's been designated by President Biden to be his point person. General Perma was there, who's been leading this from before. What they both attributed to the commitment for a 16% increase in vaccinations and consistently over the next 3 weeks. The governors, every governor, most governors in the country were on the call. We're asking for some predictability, some certainty, so we could all plan based on an expected number of doses that the states were going to receive. what we heard in response to where the additional dose is coming from is that the manufacturers and the supply chain is responding and pumping out more vaccines, and that's good news. Dr. Rattay mentioned the Johnson & Johnson trial or data that's coming. So that could be, shortly, we don't know. But if that arrives, that's a one dose of vaccine. We'll add more vaccines to the mix. And so we need to think about changes and improvements that are going to occur over the next weeks and months to factor into how we distribute scarce resources today.
Thank you, Governor. And Dr. Rattay, this is a question we've gotten several times and tried to answer from Tammy in the comments. She says, I read that getting the vaccine does not prevent you from becoming infected with COVID-19. The vaccine just lessens your symptoms. So what is true? Can you just give folks an overview of what the vaccine does?
Yeah, absolutely. So the studies that were performed for both Moderna and Pfizer showed that the vaccine very significantly decreases your risk of getting infection. So as we talked about, the first dose decreases your risk of getting infection by 50 to 82%, which is quite significant. 2 doses decreases your risk of getting the infection by 94%. But for both of these situations, what we know so far is that even for those who become infected, the consequences are less. So death and hospitalization are significantly decreased. Of course, there's more we have to learn, but I'll tell you, the flu vaccine saves hundreds and thousands of lives on an annual basis, and it's about 50% effective, sometimes even less. But even, just by preventing infection itself, but also preventing the more severe consequences, you have a tremendous impact from these vaccines.
Thank you, Dr. Rattay. And another question for you from Debbie in the comments, kind of a 2-part question. It says, Debbie asks, why is my primary care doctor not providing the vaccine? And so can you talk about the role of primary care in vaccine distribution? And if primary care doctors want to sign up, can you say something about how they might sign up to become enrolled providers?
Yeah, absolutely. So I don't know the count at this point, but last time I looked, we had about 300 providers who had enrolled to be able to provide the vaccine. So there are many providers, not just primary care, but specialty care as well. So let's say you go to an ENT or you go to a cardiologist or an oncologist. There's a variety of different physicians in our state that want to be able to provide the vaccine. Some primary care providers are very used to providing like the flu vaccine on an annual basis. Some just aren't. And so, for those who are willing to provide the vaccine, we commend them. We also apologize to them that we haven't been able to get as much vaccine to them as we'd like. For some, they haven't received any yet. But there are other primary care and other physicians that are choosing not to participate, which is fine. But we want to make sure that they know, that there's other options. And so if people check our website, you can see the options. For example, the pharmacies that are or will be soon providing vaccine. But again, I'll say this, I think is really important, whether it's your primary care provider or your pharmacist or these events that we're holding, because the vaccine is very limited right now, it can be challenging to find the vaccine in any of these locations. So we just ask people to continue to be patient, please.
Yeah, and I'd just like to underscore that last point, because we have plenty of pharmacies, primary care physician practices, hospitals, and our own pods and Curative and Vault that could get out thousands more doses of vaccines. And the primary care docs want more, those that have enrolled. And the pharmacies want more. We're just not getting it. I mean, that's just the reality. And that makes it difficult for Dr. Hong to make his allocation. We apologize to primary care that could do more. We know they could do more. Some could do 50 a week or more. Well, you add them all up, it gets to be a big number. We wish we had the supply that we could provide to all the pharmacies, all the docs, our hospitals. We have a great opportunity with hospital distribution, in my view, based on our report this week.
Governor, we have a question about just that in the comments. Can you talk about the role of the hospital systems in vaccine distribution in your conversations with the hospitals?
Yeah, so it differs by hospital organization. Christiana Care is the largest, and they had the events Friday, Saturday, and Sunday, 3,000 vaccinations. That's incredibly good. BB was a great partner for us with the pods in Georgetown. Bay Health was a good partner with one of the pods at DMV in Dover, and they also had a clinic themselves at the Blue Hen Mall. Nanocoke, in their small way, wants to move out. Actually, 1,000. They're talking about 1,000 capability of doing 1,000 doses. Nemours has the ability to do all that. If we could just get the supply, we would need to have agreements with the hospitals that there's certain distribution goals that they'd have to meet with respect to geographic and other demographic representation and diversity. But we could turn them loose if we just had the supply. It'll come gradually. And right now we're making allocations on a week-to-week basis because that's all we know. 1 week in advance. We got a 3-week commitment. We'll see how good it is in the next 3 weeks from the federal government. Today with an increase, we'll see what that increase is, and we'll build that into the allocation plan, which will include some reservation again and some delivery for those second doses.
Thank you, Governor. We have a question on Facebook from Maureen McCaffrey, who asks, who is actually giving the shot at these vaccination events at the DMV? Is it volunteer nurses or hospital staff? And I'll just add on, if people want to volunteer, where can they volunteer? Maybe both of you can speak to that.
So if I was the volunteer, I wouldn't be doing it. We have, and I want to thank all the volunteers, going out to the DMVs and thank the Del.dot employees with the traffic, state police, paramedics, Kent County, Sussex County, Newcastle County, the Medical Reserve Corps. It's people that are authorized to give vaccines, and I'll let Dr. Rattay explain that. But we've had hundreds, probably thousands if you add them all together. I know we've had thousands sign up for the Medical Reserve Corps to help out. We've had an outpouring, frankly, of volunteers. Not everybody can deliver the vaccine. And again, if we had more supply, we could deliver more and we could put more people to work. But I was at both DMVs at Delaware City and at Georgetown. I saw the difficulties at both on Saturday and know that it went much better on Sunday. I saw all the volunteers, incredible outreach and volunteers. The Delaware Medical Reserve Corps, I think it's on the website. Dr. Rattay, I'm sure, can direct folks to where they can volunteer.
Yeah, absolutely, Governor. I think one of the most uplifting aspects of this whole pandemic is, at these events, seeing the commitment of volunteers coming out this past weekend in the cold and, really enjoying being a part of supporting this effort. As far as who gives the vaccination, it is those individuals in our state who would ordinarily give a vaccination. So a lot of nurses. We've had public health nurses, but we have many volunteer nurses. Our school nurses who've had, one of the most challenging years of their lifetime. Many of them are coming out for these events, which is really heartening. But we also have doctors, pharmacists, others out there. I myself have really enjoyed vaccinating in the line. It's just, quite frankly, really uplifting. People are so happy to get their vaccine. So, but again, it's individuals who are trained to give vaccination, but there's opportunities for people to volunteer to do many different things, even if you're not a person with a medical background at these events.
And Dr. Rattay mentioned that I want to shout out to the pharmacists who helped us. We've got a core of pharmacists. They cut the vaccines. They come in vials, I guess, of 5 or 6 doses. They got to be cut just right. And the pharmacists have really stepped up and really helped us with that. We thank you very much. And did I mention the Del.dot workers who really came up big for us as well?
We love our Del.dot team. They have been so unbelievably awesome to work with. So they deserve such a big shout out. And the whole team was there. Secretary Majeski was there directing traffic and showing support and being part of the team as well.
Thank you, Dr. Rattay and Governor Carney. We have a couple other questions about these larger vaccination sites and just lessons learned. Somebody asked about the traffic in Delaware City at the DMV. Do we have any lessons learned on the traffic or the process during this sprint over the last couple of weeks? And are there any plans to continue or increase these mass vaccination sites?
Yeah, we had a lot of learnings, frankly. The team got together Saturday night, and some of them included, so we based the number, so 3,000 on the number of doses that we had and the throughput that we got at the Kent County event a week earlier. This population was a little bit different. They were older, and so they needed more hand-holding. Everybody didn't come through ready with their questionnaires filled out completely. That was a problem. We identified folks that were a little bit older, had pre-existing conditions, and so we didn't permit householding. Householding would have made a big difference if you had put husband and wife together and had them both come through. That takes out one car from it. It was very cold, and some of the computers which we were using for the first time were freezing up. The people who were operating the computers, because folks hadn't filled out their form, had to do it by hand, and that was difficult, particularly if your computer was breaking down. So we had a lot of improvements, and we tried to do too many, frankly. We gave too many appointments. If we had done any of those things, if we'd done them all, it would have been, really a smooth operation. The next day, much, much smoother. Almost we got the word out earlier. Most people had their questions filled out. We had support with the electronic system and the computer system and the like. But the volunteers, those that were there doing the vaccination, the Del.dot people, everybody else, the public health team just did an exceptional job. And on Sunday and even on Saturday with the thousands of people that were vaccinated. Anything to add to that, Dr. Rattay? It was a whole series of things. But if you think about it, a minute here, a minute there, times 3,000, that's a lot of minutes.
Yeah, I mean, I think we overestimated what we could accomplish from the weekend in Dover before, because we were able to get the same number through, but we specifically targeted some of our oldest and most ill Delawareans to protect them for this event, and we all wish that they hadn't had an experience of spending too much time in traffic and so much time waiting in their cars for this vaccine. But we certainly have learned a lot. I think we really did not, have the foresight to understand how much the weather would affect this operation. And so we know now we certainly will be doing things differently. We know we're not going to be perfect going forward, but we certainly have made some improvements and will continue to improve as we go forward.
And I'd just like to, as governor, apologize again for the inconvenience of folks that had to wait so long in line. Part of it's my fault. I've been pushing our team to really get those vaccines in people's arms. And, we'll get better. We'll learn in each event we have and get better and deliver this in as a fast and as effective and efficient way as we can. and we'll do it with as much hand holding as each of our groups require to get effectively through the lines.
Thank you, Governor. And Dr. Rattay. Dr. Rattay, we have a couple questions for you about our waiting list at vaccinerequest.delaware.gov. Dawn McCarthy in the pre-submitted questions, and we received a few similar to this, says, I registered on the waiting list. Why haven't I received an appointment to schedule my vaccine?
Yeah, that's a great question. And I'm glad to have an opportunity to talk about this because, we're in this 1B population aiming to vaccinate, almost 200,000 people. We have probably about 100,000 people on the waiting list now. We know we have some duplicate names, but probably about 100,000 people on the waiting list. And, we've moved a lot of our vaccine towards this effort of vaccinating people who are 65 and up, but it's really just a drop in the bucket. So we're going to keep doing all we can to make opportunities available for vaccination, just like the 2 curative events that I mentioned this week. We have another event as well this weekend. More information is forthcoming with that. But one of our lessons learned this weekend is that these type of events may not be for everyone. These type of events may not be the best place for individuals in their 80s and 90s with chronic conditions. And so we're also going to use this wait list to make sure that people on the wait list are aware of their options and think about their other options. We'll also be doing some smaller events as well. And so, hopefully we'll be able not just to, help people get to these larger events, but also, for those for whom better options are available, we want to use this wait list to communicate to people, what those options might be for them.
Thank you, Dr. Rattay. And we have time for a couple more questions. We have a follow-up to that from the same follow-up from Kathleen Reynolds and from Catherine Schoenberg. It says, who both ask, if I'm registered in the VAM system on the waiting list, will it automatically schedule my second shot? Will it give me an opportunity to schedule my second dose in that same system?
Yeah, great question. So once you have received an invite to the VAM system, and if you've registered yourself into the VAM system, you can go back into the VAM system. So let's say you were stuck in a line this Saturday and you couldn't, you couldn't endure, the longer wait, because I know a lot of people are worried about that. If you've registered in the VAM system, you can go back into it. If you got your vaccine in the VAM system, you can go back into it. Now, right now, we don't have events there available for you to schedule your second vaccine, but they will become available over time. Again, we'll be communicating this, so check your email over time. Again, you're not going to be able to schedule your second dose in the next, couple of weeks in the VAM system, but that will be an option for you. So you just, can go back in there and schedule yourself for an event once you're already registered into the system.
Yeah, and I think it's important to point out that it's important to be in the system, right? Because there will be opportunities created for you to get an appointment from the system. But you should also approach your primary care physician and your pharmacy as we, distribute supply to them. Again, supply is limited. That's really the bottom line. And so we're going to try to get as much as we receive. What we're trying to do is right side, right? The supply that we get from the federal government moving out into people's arm, the next week with some reservation for those that are going to need to get a second shot as well in the very vulnerable and very at-risk populations.
Thank you, Governor. We're going to do 2 more questions and then go to you for closing comments. We have a follow-up about supply in the Facebook comments from Phyllis Lacates, who asked, why is supply so limited in Delaware compared to neighboring states? Can you give us any context on how those supply decisions are made?
Yeah, I don't think that's an accurate statement that it's any more available in other states. It's on the White House call that we had today, the Biden administration made an ongoing commitment to distributing the vaccine proportionally to each state by the number of adult, their number of in their adult population. So we're proportionally getting as much as every other state. And as I understand what they told us about the 16% increase, that it would be proportional. So we would get our allotment. I heard governors from Arkansas and New York and Connecticut talking about that was something that was important for them. Every governor wants to get proportionally their fair share, and that's what we've been told that we've got. It's just a matter of limited supply. The producers, Pfizer and Moderna, can only produce, I think the number I heard today was 4 million for one and 5 million for the other, something like that, somewhere in the 4 to 5 million doses a week for the whole United States of America. And so our allotment is, you can see it right on our vaccine tracker. It's something like 15 to 20,000 a week. And we have these priority populations. We did the 1As. We're still working on 1As. Some of the 1As have already come back and gotten their second vaccination, particularly those that work for the large hospital system. Some have reserved for all of that. And so this is the challenge that we have. We've got more people who want the vaccine with not enough vaccines to go around.
Thank you, Governor. And this is our last question, and then I'm going to turn it back over to you for closing comments. But I think this is a good last question from Paul for Dr. Rattay. This was in our pre-submitted questions. He says, with the relatively high level of COVID-19 cases in the community, should we continue to wear masks and social distance as we roll out vaccine distribution?
That's such a great question. And I'm really glad to get to talk about this because yes, it is still going to be quite a long time before we reach herd immunity. I mean, some are estimating maybe September. If the vaccine rollout is a success, we get the supply that we need. But in the meantime, everybody needs to continue to wear face coverings and to social distance. And you know, I hate to say it, but as we're starting to see some other strains available, other variants of the COVID virus, the UK one, as an example, that's more contagious, that's even more reason now to be diligent to these important protection measures, especially face coverings and social distancing, and really just staying apart from people as much as we can at this point in time.
Yeah, so that's a really good place to end, right? Which is where we began to talk about where we are today in Delaware with respect to the spread of COVID-19 in our community. The data that we presented at the beginning showed improvement, a significant improvement in the number of new cases on a daily basis, on the percent of the tests that we're doing that are positive, and we're doing way more tests than I ever thought we would be able to do. And most importantly, the number of hospitalizations under 400 for the first time in a while. We have 600 new cases, but these are high numbers nonetheless. We're turning the corner, we're getting better, but we need folks to continue to mask up. It's obviously working. This week, we heard news that there were gonna be some staff changes at the Nemours because their business is way down. The business is way down with young children not coming through the hospital because they have very few flu cases this year and cases that require hospitalization among children. And that's simply because people are wearing masks. We have very few flu cases this year compared to a normal year. Dr. Rattay is shaking her head because people are complying. People are masking up. People are keeping appropriate social distance. People are staying out of large gatherings and being careful when they circulate. If we do all that, we'll protect ourselves. The vaccines is the most important thing that we're doing, but in some ways it can be icing on the cake with all these other things that we're doing. And the fact of the matter is, we're just not going to have the supply for the demand that's out there. We're talking 15 to 20,000 a week. Add 16% to that. That's somewhere 2,500 to 3,000, whatever that is. It's not enough. We're still working through our 1As, 70,000 in that population, times 2, 140,000, 200,000 in our 1B, 65 and older, really targeting those who are most vulnerable in that population. That's 400,000. That's over 500,000 doses required. Now we know that some people don't want to get vaccinated, and we would suggest that you reconsider that decision. But going through that at 20,000, 25,000, even 30,000 a week is going to take us too long to get to where we want to go. And that's why some of the changes that Dr. Rattay talked about, the Johnson & Johnson vaccine, how close is that? Is it a week, 2 weeks, 3 weeks, whatever it comes? That's one dose, and it's a whole new supply. And it'll be a big boost to all of us. And then, of course, the companies Moderna and Pfizer with their vaccines ramping up production will help us as well. So stick in there with us. We'll try to get as much information as we can to you, as transparently as we can, to make sure that every Delawarean has access to get that life-saving vaccine. Thank you for joining us tonight. We look forward to seeing you the next time.